Okay, today we're going to talk about oxygenation and the medications that go along with oxygenation, because if your patient has difficulty breathing or isn't breathing at all, then nothing else really matters. For a little intro here, antihistamines and nasal decongestants collectively treat common colds and allergic rhinitis. The symptoms are very similar for both the cold and rhinitis, and they cause much discomfort as well as many lost days of work. Colds are viral. They invade the respiratory tract, they cause injury to local cells, and then they cause an inflammatory response. They may be followed then by a secondary bacterial infection. Allergic rhinitis is caused by an immunological response resulting from contact of one or more environmental allergens, such as dust, pollen, dander, mold, things like that. That inflammatory response then releases histamine, which is a powerful vasodilator. Histamine-induced vasodilation increases secretions of mucus, causes increased congestion, and increases sneezing. Viral is a local response. Allergic rhinitis is mostly nasal symptoms. Okay, so we're going to talk about antihistamines. Again, histamine occurs naturally. It's produced in response to tissue damage and the presence of microorganisms and allergens. Histamine dilates arterioles. It increases blood supply. Those tissues then become edematous and erythematous. Leukocytes rush into that area and deactivate and absorb those foreign substances then. Antihistamines do not block the release of histamine, but they block the action of histamine at the H1 receptor sites. Okay? So they do not block the release of histamine, but block the action of histamine at the receptor sites. Antihistamines are typically used for allergic rhinitis. Most of them are over the counter. Histamine has multiple actions in the body, so antihistamines exert multiple effects. Most of them cause a CNS depression activity, which is in turn causes sedation. They can also cause dry mouth, constipation, blurred vision, and urinary retention, especially in the elderly. They have a drying effect, which may thicken respiratory tract secretions and increase breathing difficulties for those with asthma, emphysema, or COPD. They are contraindicated in nursing mothers because they inhibit lactation, and they can also be secreted in breast milk. Young children may exhibit signs and symptoms of hypersensitivity to antihistamines. Some of your common antihistamines are Claritin or loratadine. It's contraindicated in people with hepatic or renal impairment. It should be used cautiously in people with narrow angle glaucoma, hypertension, or cardiovascular disease. Some of the side effects of Claritin are drowsiness, fatigue, diarrhea, and abdominal pain. Now, when I point out specific things like this to you in this lecture, those are the things that you need to know. You do not have to know everything else in the book that is related to those. I'm picking out the specifics that I want you to know about each one of these drugs and about each one of these categories as well. The next antihistamine is Allegra or fexofenadine. It's approved only for children greater than 6 months of age. It cannot be taken with fruit juice, and it should be taken with food to decrease GI upset. Some of the side effects of Allegra are headache, dyspepsia, cough, myalgia, diarrhea. If you combine Allegra with pseudoephedrine, you should not use it in persons with hypertension, diabetes, or cardiovascular disease. The next antihistamine is Zyrtec or cetirizine. Should be used cautiously in children under 6 and anyone over 65. Also, again, with those with hepatic or renal failure. Impairment, not failure. Side effects are headache, nausea, vomiting, diarrhea, abdominal pain. Zyrtec can be used for year-round allergies. Diphenhydramine, which is Benadryl, should not be used in children under 2. Should be used cautiously in children under 6 and in elderly clients, again contraindicated in nursing mothers, and should be used cautiously in glaucoma, those with increased intraocular pressure, hypertension, and cardiovascular disease. Your next category of medications are your decongestants. Decongestants constrict dilated blood vessels in the nasal mucosa. This reduces that blood flow to those edematous areas, slows mucus formation, facilitates better draining, and relieves discomfort. Some of the common problems with decongestants are rebound congestion. It's that overuse of those topical agents and then the return of that excess of tissue fluid, which again causes the their congestion. Excessive use causes local ischemia and irritation. Orally, decongestants may also constrict blood vessels. They have a longer duration of action, but they may aggravate hypertension, arrhythmias, heart disease, diabetes, and hyperthyroidism. Decongestants are not recommended for infants and children. Intranasal steroids are your next category. They work by reducing the edema in the nasal membranes and the sinuses. They are not associated with that rebound effect because they are a steroid. They may be used as adjunct therapy in asthma patients as well. Many times they're used when the seasonal rhinitis does not respond to conventional therapy. They'll give you a nasal steroid. They do not produce an immediate effect. It takes a while of using them before you notice any difference. They should be used cautiously in respiratory tract infections because they decrease the immunologic response. Some of your common intranasal steroids are Flonase, which is fluticasone propionate. It's contraindicated in cases of unhealed nasal septal ulcers or nasal wounds, glaucoma, cataracts, and increased intraocular pressure. Should also be contraindicated in TB patients or clients with a history of bronchospasms. Flonase may cause epistaxis, nasal burning, irritation, or headache. Another intranasal steroid that you need to know about is Nasonex. It's mometasone furoate monohydrate. It's contraindicated again in cases of unhealed nasal septal ulcers or nasal wounds, glaucoma or cataracts, TB, or ocular herpes simplex virus infections, HSV. You also have to monitor for vision changes with Nasonex as well. Your next category is expectorants. They're taken orally to stimulate secretion flow of the respiratory tract. They reduce the viscosity of endobronchial secretions. They reduce phlegm, and that coughing is facilitated with expectorants. Guaifenesin or Mucinex is your most common that you need to know about. It can be administered without regard to food. Should be used cautiously in children under 6 and in cases of nephrolithiasis. Some of the side effects of guaifenesin are rash and nausea and vomiting. Antitussives are your next category. Antitussives prevent cough, but they should only be used in cases where the cough causes respiratory discomfort or disturbs sleep, or if that cough doesn't facilitate the removal of secretions. Dextromethorphan, hydrobromide, which is Robitussin, Delsum, or Triaminic, are some of the most common antitussives. They should be used cautiously in children under 6. They have side effects of nausea, dizziness, and drowsiness. You do not take with grapefruit juice or with grapefruits because it increases the bioavailability of the drug. Bioavailability means the rate at which it's absorbed into the system and used. So if you increase the bioavailability, you may get a rush of the drug more than you want. You do not take it within 14 days of an MAO inhibitor as well. Your next antitussive is Atelolon Pearl, benzonatate. You do not chew these liquid gels. They cause a temporary anesthetic effect in the oral mucosa. Side effects are sedation, headache, dizziness, pruritus / rash, and GI upset. Those are the basics on the beginning of your oxygenation drugs. So to wrap up antihistamines and decongestants, you're to use cautiously in young children and the elderly. You should teach proper administration of nose sprays and drops. Nasal decongestants should be taken 20 minutes before meals so that it's easier for the patient to breathe while they eat. If you ever had a stopped up nose and tried to eat and breathe at the same time, it's not the most pleasant thing, or it's not the easiest thing to do, either one. Um, should be monitored. Hypertension should be monitored in cases of people that have hypertension. Antihistamines should be used cautiously. I'm sorry. Antihistamines can cause increased intraocular pressure and urinary retention. To wrap up your expectorants and antitussives, cough syrups are administered for a soothing effect, and if they are, they should not be given with other meds or followed immediately by food or water. Persons with a cough longer than 1 week and those with a high fever, rash, and persistent headache should be evaluated by the primary care physician. Productive coughs should not be suppressed. Increasing fluids helps thin secretions, and milk increases the viscosity of the secretions. So those are the basics of oxygenation that you need to know to start with for chapter 14.